Here's how to use the filter by treatment priority. On the main unscheduled treatment page, before you apply filters, let's say you have page, always make sure that you're aware of the treatment plan dates. Okay, so you're looking at the existing day to the last 6 months. If you need to change those dates, you can change them here. So now you're going to want to filter by treatment priority, let's say, for example. So let's say you want to exclude from the list of patients you see on this page, you want to exclude treatment that has been rejected or that is low priority. So from the drop down, you can actually select one or more. So I'm going to go ahead and select low, and also something that's on wait. Okay, you may have created custom ones depending on your settings in Open Dental, and then you're just going to want to hit apply filter. Okay, so now those patients will be excluded. Having said that, let's go back to Open Dental. If you're not aware of what treatment priorities are, it's when you go to someone's treatment plan, for example, it's the things you see on this list. I have next, low, recommend, or wait. You may have created something like rejected or deferred or whatever it may be. Okay. Basically, the point is those priorities, those custom priorities will show up under this dropdown for you to select. And then you can select either one or more to either include or exclude. All right. Something to keep in mind is, for example, I'm going to go ahead and refresh this page. If you have a patient, let's say you've treatment planned 10 fillings. Out of 10 fillings, five of those fillings are on treatment priority. Let's say there's one, this patient has a filling that is low in treatment priority, and this one is maybe 2. And now you go in on unscheduled treatment page, and if you say you want to exclude low treatment priority, you may expect to not see this patient on the list, but guess what? You are going to see that patient. Why? Because there's still other treatment this patient has that is higher priority, that is other priorities, right? This patient would only be excluded, for example, let me just go to this patient here. Like, for example, this patient, the only treatment plan work here is these 3 fillings, and all of them says wait priority, okay? So now if I wanted to exclude this patient, so for example, if I load this page, initially when I come to this page, I see this patient here, okay? This patient is on the list, okay? If I go to the unscheduled treatment, I see the only work they need is all of wait, okay? So now I don't want to see that patient. There's no point of me seeing that patient on this list. So I'm going to go ahead and hit exclude, and I'm going to select wait, for example. All right. And now if I hit apply filters, that patient won't show up anymore. Okay. How do I know that? I can search by patient's last name, and you don't see that patient. This is a different patient. That was Aaron's Jamie. Okay. All right. So that's how it works. So just keep that in mind that if you expect to see a patient and you don't see them on the list, you've just got to check all the treatment that's and their priorities.